origin of the human immunodeficiency virus, HIV, has been a subject of scientific research and debate since the virus was identified in the 1980s. HIV infection in humans came from a type of chimpanzee in Central Africa known as Pan troglodytes troglodytes. The chimpanzee version of the virus is called simian immunodeficiency virus. It was probably passed to human when humans hunted this chimpanzee for meat and came in contact with their infected blood. Over decades, HIV slowly spread across Africa and later into other parts of the world. HIV is a virus that attacks cells that help body fight infection, making a person more vulnerable to other infection and disease. It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex or through sharing injection drug equipment. If left untreated, HIV can lead to AIDS. The human body can't get rid of HIV and no effective HIV cure exists. So once you have HIV, you have it for life. Luckily, an effective treatment with HIV medicine called antiretroviral therapy is available. If taken as prescribed, HIV medicine can reduce the amount of HIV in the blood to a very low level. This is called viral suppression. People with HIV who take HIV medicine as prescribed and get to keep an undetectable viral load can live long and healthy life and will not transmit HIV to their HIV-negative partner through sex. What is stigma? HIV stigma is negative attitude and belief about people with HIV. It is the prejudice that comes with labeling an individual as a part of a group that is believed to be socially unacceptable. Example like believing that only certain group of people can get HIV and feeling that people deserve to get HIV because of their choices. Discrimination is the behavior that results from those attitude or belief. HIV discrimination is the act of treating people living with HIV differently. A healthcare professional refusing to provide care or service to them by refusing casual contact or socially isolating member of a community because they are HIV positive.
Malaysian HIV cases have been reported since 1986 by the Ministry of Health. Since then, HIV has become one of the country's most serious health and development challenges. Malaysia is ranked 7th highest in adult prevalence of HIV in Asia. According to the United Nations, Malaysia is one of the 10 countries which together accounted for over 95% of all new HIV infections in the region of Asia Pacific in 2016. At the end of year 2021, there were estimated 81,942 people live with HIV in Malaysia, 67,822 of whom were aware of their status and had been notified through the National Surveillance System. According to Global AIDS Monitoring 2020, it is estimated that around 87,000 people are living with HIV in Malaysia in 2019. Selangor, Kuala Lumpur and Johor were the major contributors to new HIV cases. During the early phase, the country's epidemic was driven by PWID bearing the impact of 70% to 80% of total reported cases annually. But the trend has shifted to more sexual transmission since 2011. MSM is anticipated to become the main driver for the epidemic in the near future, and more than 70% of HIV new infections are reported among people aged 20 to 39 years old in 2017. According to surveillance data, PWID or sexual transmission ratio declining from 3.95 in 2000 to 0.04 in 2021. Next, we move to the risk factors for HIV. First, having another sexually transmitted infection. People with STIs are exposed to the virus through sex or blood exposure. Second, having condomless anal or vaginal sex is the common way that HIV is spread. Third, having multiple sexual partners increase the risk of getting HIV. Fourth, sharing needle or syringes. People who inject drug remain at significant risk for getting HIV.
Now, let's move to the symptoms of HIV. These are the common symptoms of HIV, including fever, fatigue, sore throat, headache, muscle aches, and joint pain. Skin rash also one of the symptoms. There are more symptoms that show a person get infection from the HIV viruses. Basically, HIV itself may not cause symptoms, but it weakens the immunity of our body that lead to get other infection and diseases easily. Now, I will explain one by one the symptoms of HIV. So, for fever, it can be one of the first symptoms of an acute HIV infection. It occurs within 2 to 4 weeks of contracting with the virus. Now, for fatigue, its impact on a person's immune system, even in people with undetectable viral load. Besides, low-level inflammation caused by HIV can use up a lot of energy. For sore throat, it is a symptom of acute HIV infection. Headaches can occur at any time during the infection, including at seroconversion during the incubation period, in patients with a symptomatic HIV-1 infection, or after an AIDS-defining illness. Skin rash occur in early or later stage of HIV infection. It is an irritated skin that can be itchy, red or purple, and painful. Now, for the last symptoms of HIV, which is muscle aches and joint pain, it can occur in the first few weeks after getting the virus and can last for a short time or go away for years. Now, to prevent being infected by this virus, these are the steps that need to be done to reduce the risk of being infected. The first one is protect yourself during intercourse by using condom. Second, never sharing syringes or needles with anyone. Next, people need to prevent prenatal transmission and only having intercourse with their partner. Besides, people also can take advantage of HIV prevention medicines such as post-exposure prophylaxis, also known as PEP. Last but not least, people also are advised to avoid skin contact with the infected person if they are having open wounds to prevent of getting a bacterial infection.
Next is HIV treatment. What is HIV treatment? HIV treatment involves taking medicine as prescribed by a healthcare provider. HIV treatment reduces the amount of HIV in your body and helps you to stay healthy. There is no cure for HIV, but you can control it with HIV treatment. When should someone with HIV start their treatment? Those who are living with HIV should start their HIV treatment as soon as possible after diagnosis. All people with HIV should take HIV treatment no matter how long they've had HIV or how healthy they are. What if someone delays their HIV treatment? HIV will continue to harm your immune system. It could put them at higher risk for transmitting HIV and developing AIDS. HIV treatment or medicine called antiretroviral therapy ART. ART involves taking a combination of HIV medicine called an HIV treatment regimen every day. ART is recommended for everyone who has HIV. People with HIV should take their HIV medicine as soon as possible as prescribed by their healthcare provider. So how do HIV medicine work? HIV basically will attack and destroy the infection-fighting CD4 cells, CD4 T lymphocyte of the immune system. Loss of CD4 cells make it hard for the body to fight off infections and certain HIV-related cancers. HIV medicines prevent HIV from multiplying, making copy of itself, which reduces the amount of HIV in the body called the viral load. Having less HIV in the body gives the immune system a chance to recover and produce more CD4 cells. Even though there is still some HIV in the body, the immune system is strong enough to fight off infections and certain HIV-related cancers. So by reducing the amount of HIV in the body, HIV medicine also reduces the risk of HIV transmission. A main goal of HIV treatment is to reduce a person's viral load to an undetectable level. An undetectable viral load means that the level of HIV in the blood is too low to be detected by a viral load test. People with HIV who maintain an undetectable viral load have effectively no risk of transmitting HIV to their HIV-negative partner through sex. In conclusion, those who have HIV should take their medicine as prescribed, and everyone should practice safe sex to prevent themselves from getting HIV and AIDS. Thank you.
Thank you for watching.